afternoon, and thank you for joining us today on Facebook Live. I am Sherry Wenzel, and I'm the coordinator for Mental Health Services. We're here today to talk about back to school tips to help us and our children prepare mentally to go back to school in August. I am co-presenting today with Caroline Brennan from Collier County Schools. I'm going to allow her to introduce herself.
Hi, I'm Caroline Brennan. I'm the Supervisor for Mental Health Supports for Collier County Public Schools, and I always welcome the opportunity to coordinate and present information with our neighbors right across the county line. So it's nice to be with you today, Sherry.
All right, nice to be with you as well. So today we're going to talk about some different things that we can help our children prepare to go back to school. We're going to talk about the tolls of isolation and the obvious pandemic that we have still going on mental health. What are some of the mental health concerns for returning to school, both for ourselves and for our students? Some signs of mental health or behavioral concerns, some tips for supporting your child's mental health. We're going to touch on suicide awareness and prevention, and then we're going to talk a little bit about some district-specific mental health supports and resources that you can access in Collier and Lee County Public Schools. Now I'm going to turn it over to Caroline, and she's going to get us started.
Thanks, Sherry. So if we look back on what was the toll of the isolation and the pandemic, we all experienced and went through this. We had businesses that closed, families that lost jobs, subsequently losing incomes as well. Many parents, if they didn't lose a job, were forced to take off of work in order to be home with their children and to be able to help them navigate their education online. We had a lot of lost relationships and connectedness to others during this time. Extracurricular activities, sporting events, musical events, whatever your student may have been involved in, a lot of those things were canceled during this time. We also had individuals who lost loved ones or became ill. And so subsequently, our students really struggled to maintain academically through both online learning, and for those others who did return to school, they did so with social distancing guidelines and masks. And that caused a lot of students to either fall behind in their education or feel somewhat unsuccessful in their education. We also may see students that are going to have some undeveloped or underdeveloped social skills as a result. And for others, they might have social skills that might just be a little bit rusty during this time. We're going to talk about some of this a little bit later when we discuss suicide prevention, but as a result of everything we experienced during this time period, the pandemic and the increased isolation, we saw tremendous increases in our youth experiencing anxiety, depression, and suicidality in our communities. We have also seen increases in reports of domestic violence, child abuse, substance abuse, and this leads to increased trauma for many of our students. I think at this point, it feels like we've all kind of been running a marathon. So when we just begin to feel like we're approaching the finish line, very few people have a whole lot left in their tank of resiliency. And many students and adults alike report simply feeling kind of worn down. So if we look at the next slide and our mental health concerns as we return to school, for many individuals, just the adjustment alone of returning to the schedules, the rules, the routines that we normally would have followed can be a struggle. And they have to learn how to effectively navigate those, not just at home, but in school as well. So a lot of our kids were also entrenched in a digital world already. And then when we started to learn online, it seemed like online in our digital world became the sole form of communication, education, and entertainment during this time. So returning to school can be a huge shift for many students and for the adults. We now need to look at how we confront those in-person interactions again. So we know we've seen a tremendous increase in youth mental health concerns during this time. For many, however, access and availability of treatment was also an issue. There were a lot of barriers to receiving services. Some families lost insurances during this time, or their providers didn't accept the insurance that they did have. And we also had a lot of isolation and significant increases in wait lists during this time with mental health providers. So for students who maybe needed medication or ongoing therapeutic services, they could be particularly damaging to their mental health. Our mental health system was also extremely overrun trying to support the mental health needs in our community during this time. And as we know, or as many of us know, only 40% or less of individuals who actually need mental health services at any given time actually seek treatment. So with the system already being overwhelmed and there being barriers to receiving services, we know that as students return to school and needs are identified, we're going to be challenged with meeting those needs. I think that a lot of people have realized during this time, and I actually hope it helps reduce a little bit of the stigma attached to mental illness and mental health. We always thought of, mental health and mental illness on this single continuum, and you were at one side or the other. But I think we're realizing, as many people have struggled with challenges during this time, that we really function on a dual continuum. And many of us occasionally struggle with poor mental health. So not having a mental illness doesn't really guarantee that you're also mentally well. So while a student might not have a mental illness, they might be dealing with significant mental health concerns due to these struggles. I guess I'd like everyone to kind of think of it like the backpacks that our students wear to school. So if you try to visualize that along with all of the other things they have to put in their backpack, try to imagine as physical objects the feelings, the stressors, the responsibilities, the expectations, experience, and worries that a student may have had during this time. They're bringing all of that with them. Imagine them carrying that around with their other belongings. For many of our students, this can become way too heavy for them to carry, especially depending on their size, their strength, and how long they have to carry that for. We need to remember that many of our students are going to be returning to school with emotionally heavy backpacks. So finding ways to build student resilience and connectedness, as well as helping them to find healthy and effective coping strategies, is going to be critical as our students return to school. And with that, I'm going to turn it back over to Sherry, who's actually going to talk about what are some of the developmental signs of mental or behavioral health concerns, and to give you some tips for how to support your child's mental health. Sherry?
All right. Thank you, Caroline. Yes, today I would really like to kind of talk about, I'm a parent. What are some things that I need to be concerned about? What are some things I'm seeing in my student, in my child, that may or may not be a mental health concern, but maybe, as Caroline said, we're talking about my child's mental wellness. So some of the things that you may be seeing, especially in the preschool and elementary school years, is we're talking about behavior problems. We're talking about maybe your child not listening, not following the rules, having a difficult time following the schedule and the routine of a typical school day. They may be hyperactive way beyond what other people would consider kind of normal childhood behavior. And that's kind of where it gets really difficult as a parent, as a provider, and as, a school personnel, is like, what's typical behavior and what is beyond that typical behavior? Maybe my child is having a hard time sleeping. They might be having some nightmares. What are some of those things that I should be overly concerned about? We may see a lot of, like Caroline said, excessive fear, worry, crying, because they're feeling the tension maybe within the family home, because there has been a lot of stress based on financial needs, loss of jobs, loss of services, all of those things that we've already talked about. And as a child, whether they're preschool or elementary, they can sense those stressors. They might not necessarily know exactly what they are, but they can sense those stressors within the adults in their lives. They may have some extreme disobedience and aggression. Your child I've heard a lot of parents share that my child is hitting more often, maybe biting more often, because they have like all of these emotions. And when they're young, they don't know what to do with all that. They have temper tantrums. And the consistent thing here is like all of the time. They may have persistent difficulty separating from a parent, especially if your child last year was virtual the whole year. Many of our students were virtual since March of 2020, and that is over a year. We're talking almost 18 months of virtual learning. And so they may have a real difficult time separating from their parent, because their parent has been there with them every day, making sure that they were doing their online work, things like that. And they may have a real hard time separating from them. But I think the big word here that I want us all to focus on is persistent. And it does say persistent difficulty separating from parent, but I want us to consider using the word persistent in front of all of these behaviors. And as I go through elementary and then secondary signs and behaviors, those are the things that kind of make it different than what we would call typical childhood tantrums, typical childhood behaviors. Is it persistent? Are they able to transition to having a hard time and really having a behavior problem, but are they easy to be redirected? Are they, as a parent, can you redirect them? Do they have a hard time focusing? It is that word persistent that we're really going to be looking towards. And as we get ready for our first day of school, which, believe it or not, the first day of school is August 10th for both Lee and Collier counties. So we want to make sure that we are really honing in on our students' behaviors prior to the first day of school. And as I go on, we're going to also talk about what are some things that you can do as a parent now as we get ready for August 10th. So the next slide is going to talk to us a little bit about those grade school years, a little bit about when we say grade school years, we're really kind of talking about, fourth, fifth, all the way to like maybe seventh or eighth grade. Again, they may have like a lot of worry. Our kids really kind of, especially with social media, with the instant access to information, now they may be getting cell phones, they may be texting with their friends, they may be doing our favorite Snapchat and Instagram. And I know Facebook is only for old people now, but those kinds of things. And so they're communicating digitally with their peers, and they may have like fears and worries about, is the pandemic coming back? What does that look like for me? As we hear in the news, there's different strains, there's different things going on. And that's a big worry for a lot of our students. And they don't know what to do with all those feelings. So they may become hyperactive. And that may result in a sudden decrease in their school performance. When they were home last year and you were kind of there, kind of like as a parent, I know that I'm like on top of my kids all the time. Like, did you do your homework? I'm constantly checking all of their assignments. I'm online checking their grades. Did they turn everything in? And so you're kind of doing that when they're with you at home. But, when they're at school and they're trying to kind of transition from being at home with you possibly to now being back in school, they may have a decrease in school performance. Their grades may go down a little bit. What also causes concern is a real loss of interest in friends or favorite activities. If you really see your middle schoolers and your high schoolers start withdrawing, it's kind of common for them to withdraw from us as adults. But when they really start withdrawing from their friends, then that's something that we need to really be concerned about. And I go back to that word persistent. That's that persistent loss of interest, persistent loss of appetite. Excessive worry. We have a lot of our students who worry about weight gain. They worry about what other people think about them and their physical appearance. They may have a sudden change in sleep habits, although we do know that most teenagers would rather sleep 24 hours a day than actually get up and do anything. But, we're talking about those abnormal sleep habits. You know your child best. If you are the parent, the caregiver, you know what your child's typical sleep patterns are. So they may be sleeping a lot more, or they may be sleeping a lot less. And these are things that we really need to kind of hone in on and pay attention to. They may have visible prolonged sadness. They may tell you as a parent, I'm really sad. I just don't know how to get over this. You may see a lot more substance use or abuse. We also have students within this age range who are beginning to kind of start with those typical mental health concerns by seeing or hearing things that are not there. And so, in addition to the pandemic and transitioning back, when we're talking about those grade school years, we're also talking about these are some times where some real mental health concerns or mental health illness may start to arise. And so how do we as parents and school administrators, how do we help our children navigate what is due to the pandemic and what is due to really a mental health illness, and what can we do and what steps do we need to take? And as we transition into the high school years, those are everybody's favorite years, you may see things such as destructive behavior, damaging property, or setting fires. We're talking about those kids that are punching holes in your walls, throwing things, throwing things at school, maybe constantly threatening to run away, or maybe they have run away from home. And those are all things that we need to make sure that we're paying attention to. They may withdraw from family and friends. They may actually indicate in writing or verbally thoughts or desires to harm themselves or harm other people. And those are really, really red flags for not only just us at the school, but you at home as well. If you have a student that is really, or your child is writing about or talking about wanting to hurt themselves or other people, those are red flags. Those are when we really need to reach out to our mental health professionals, and we really need to get that support for our student as quickly as possible. They may have risky behaviors. What is a typical high school risky behavior? I grew up here in Lee County, and I remember jumping off bridges out in Sanibel, jumping off bridges on the Peace River, all of those things. Now I'm looking back, I'm like, well, there were really alligators there, or there was really an undercurrent. And if I knew that my child was doing that right now, I'd probably have a heart attack. So what is typical risky behavior for teenagers, because their brain just hasn't developed enough to be able to kind of see what those consequences are? And what is excessive risky behavior? What is is a lot of car surfing. When I worked at a high school, I saw a lot of car surfing. Believe it or not, kids are on the hoods of cars driving through the student parking lot, weaving in and out. That is, in my opinion, excessive risky behavior. So how do we distinguish that between what would be typical adolescent risky behavior? If it's persistent, I just go back to that same word of persistent. Is it happening all the time? The same thing with substance use or abuse, especially at the tween and teen years. We are really talking about that experimentation. What does that drug feel like when I take that drug? Is it experimenting, or is it persistent? Is it something that your student or your child is using daily? It is something that you are seeing signs of not only at school, but at home. And what does that look like? And how do we help support our students who may be having, and your children who may be having those mental health challenges in addition to substance use or abuse? So as we are going to talk about tips for supporting your child's mental health and what that looks like. And what I want to say here is that communication is the key. We want to communicate consistently with our child, with our child's schools, with our child's providers, whether it's a pediatrician, whether it's a therapist, whether it's a psychiatrist. We need to make sure that we are really, really focusing on those avenues of communication. And we want to establish routines. That is the biggest. If I can give you any nugget, any one thing that you take away from what I'm saying here today, is establish a school day routine. And we need to do it now, especially for a lot of our kids who it's been 18 months since they've actually physically had to get up and physically go to school. Those morning time routines are going to be rough. They're rough in a good year. Sometimes some of our kids getting up in the morning is not their thing. So now is the time. I'm talking today, what is your bedtime routine? What is your morning routine? What time do you have to get up in the morning to go to school? So now is the time within the next few weeks where we really need to start establishing those routines with our children. Start those bedtimes now. Start those, it's time to get up now. And especially for our younger students, maybe even call the school and find out what time their lunch is. Because guess what? When they're home with you, if they want a snack, I'm sure you just gave them a snack to get them through the day. But they're not going to have some of those same options when they go back to school face to face. So maybe you want to find out what time their lunchtime is and really help get them in the routine of really not eating a whole lot. Make sure they eat breakfast. When is the next time they can have a snack? Or in the morning, do they get a morning snack in an elementary school? What time is that typically? And then what time is lunch? So that you can kind of get their stomachs on that same routine as well, because nobody functions well when they're tired or hungry. Those two things, they're not going to have a good day. I don't have a good day when I'm tired and hungry. We want to incorporate positive reinforcement. Tell your students that you're proud of them, that what they're doing is good. And we as adults, no matter how kind of crazy it gets and how stressed out we may be due to things that are going on in our lives, we need to make sure that we're maintaining an optimistic and positive attitude with our children. We need to be excited about them going back to school. We need to be positive about what that is. We need to also exercise compassion. We as school-based administrators and school-based personnel, we're going to be practicing exercising compassion, and we would expect our parents and caregivers to do that as well. Because our students, as you know, I already went through, they're scared, they're depressed, they're anxious, they're worried. What is this going to look like? I don't have to wear a mask today, but maybe, in 2 months, if things don't go well, am I going to have to wear a mask again? I really didn't like wearing a mask. So now I'm worried about, am I going to have to wear a mask or not? Just those kinds of things. And we just really need to take the time to communicate with your child. Listen to what those fears are. Listen to and acknowledge them and say, those are real fears. These are real things that what can you do? What can you do during the school day to help yourself not be so worried? Can you talk to your teacher? Can you talk to somebody else at the school? But we want to make sure that as parents and caregivers, the biggest part of supporting your child's mental health is communication. Communicating with your child's teachers, and your schools. So some other tips are setting up for supporting your child's mental health is meet the teacher. If they have face-to-face open houses. Last year they had virtual. This year, if your school is having a face-to-face open house and your child is going back to school face-to-face, physically take them there to meet their teacher face-to-face. What does that look like? What does my classroom look like? Where am I going to sit? Especially at the elementary and middle schools. A lot of times for the open houses, they have the names on the desks already. So the kids will actually have a physical, know where they're going to be physically within the classrooms. We want to make sure that if there are concerns, there are plenty of books and YouTube videos on how to prepare your child to go back to school, how to help them with worries, how to help them with anxiety, set up school zones and expectations. And that goes along with establishing a routine. Make sure that you have a place in your home that is quiet. If your child has been virtual all year, you don't put that desk away. They're still going to need it back in the school year. Have that place where they can do their homework, put their book backpack, things like that, so that everything is in one place. Because I know what it's like, when you wake up in the morning, and I've experienced this, where the kid can find one shoe, and you spend 30 minutes looking for the other shoe, in the morning. And that really kind of causes the student anxiety. It causes you as a parent anxiety, because you're like, I'm going to be late for work and things like that. So it's really important to establish those routines. Maybe that routine is you and your student pick the clothes out the night before that you're going to wear to school the next day, and always put them in the same place. So you're not running around, or you're not, the student is like, what I wanted to wear today is not clean. I cannot tell you how many times my children said that. And as they got older, they just bought themselves some Febreze, because they would literally just Febreze their shirt if that's what they wanted to do. you know. And as they got older too, they also slept in the clothes because their school started at 7 a.m. and they did not want to have to get up early enough to worry about dressing. So those are some things, the routines that can be set up. Take your kids shopping with you. Get excited about the new school year. If you can go out and even if you're going to like any of the backpack events, get excited about getting your child the backpack events. Take home the backpack, go through it, get excited about the new pens and pencils and paper and crayons and markers and all of those things that are in the backpacks. So if your child sees that you are excited, they're going to be excited too. And I go back to please practice your new routine. Now is the time to get started on that. Please don't wait till August the 9th and say, hey, you have school tomorrow. You need to go to bed tonight at 8 o'clock. That is too late. Please start working on those routines now. If your child typically has an 8 o'clock bedtime for school, but during the summer they have a 10 o'clock bedtime, well, we have enough time. Maybe for a few days you make them go to bed at 9:30, then at 9, then at 8:30, and you kind of work your way back to 8 o'clock so that by the time school starts, by the time August the 9th comes around, your student understands that the expectation is that they go to bed at 8 o'clock so that they can be fresh and relaxed and rested for the first day of school. So now I'm going to turn it back over to Caroline, and she's going to talk about suicide prevention.
Thanks, Sherry. So why are we talking about suicide prevention as it relates to our students returning to school? We're talking about it because we have to. Basically, Collier and Lee counties have seen anywhere from a 44% to 60% increase during this time of students experiencing suicidality or having made a suicide attempt. As you can see, it is now also the second leading cause of death among young people over age 10. The death of a child is tragic, and to see that more and more children are dying at their own hands, we need to respond to it. We need to do something. Our expectation is that as children are returning to school this year, they're going to be more vulnerable based on the factors we spoke about earlier when we discussed the toll that the pandemic has had on students and families. A lot of students have suffered in silence during this time. And with the adjustments of returning to school, hopefully we can begin to identify and address the mental health needs of those students and get them the support that we need. So when we look at preparation on the next slide, how can we prepare to address suicide prevention? How can parents help to be prepared to address it and address any potential suicidal ideation in your own child? Basically being aware of the fact that youth have thoughts of suicide when they are feeling overwhelmed, helpless, and disconnected and hopeless. Knowing that and having that awareness right off the bat can be helpful. We can look at how do we minimize our household stress. I think that Sherry gave a lot of great tips on how to get prepared and start planning now and establishing those routines and that structure. But when our families are feeling overwhelmed and stressed, if we can try to minimize how much of that is occurring in our home, it can really be helpful. And trying to make some time to connect with each child in a meaningful way. Having that sort of one-on-one fun time can really be helpful. And I think we all get so caught up, especially now with living on our computers and our phones, that we forget we need to have that face-to-face connection and contact. The other thing is modeling appropriate and healthy ways to cope with stress. Children learn a lot more from our actions than they do from anything that we say. So if we try and start practicing with them, what are some healthy ways that we cope with things? Maybe we can start doing some breathing together, or some yoga, or some meditation, or going for some long walks, and do those things together with them. You'll help model that for them. And also giving children the space and the opportunity to begin to engage in conversations with us. Spending more time listening than we do talking is critical. And when we say listening, we mean listening without judgment. Hear what that child is saying. What are they feeling? What are they experiencing? We really want to understand. And so the more we listen, the more we're going to be able to have that opportunity to really know what they're going through. So on the next slide, we have some of the warning signs that we might want to look for. And one of the things that I think is important is to go back to something Sherry said earlier, which is looking for those things that are more pervasive, that are extreme, because sometimes things like withdrawal from families and moving towards peers or having changes in behavior or sleep patterns or hygiene, some of those can be somewhat related to typical adolescent development and some of the changes we might typically see. So we want to make sure that we're looking for those extremes, recognizing that they may shift their peer group, they may shift their activities. If they stop doing an activity they typically loved and enjoyed, my question is, have they re-engaged in a new activity? Maybe their preferences are changing. So we want to look at if they stop and are not engaging with new peers or not replacing those things with new activities, that's when I would want to be concerned about what they're doing. So what do we do if we identify some of these warning signs in our child? And on the next slide, we can see that we want to first start the conversation. Ask how our children are feeling. Let them know the changes that maybe you've observed in them. Let them know that you're concerned about them. You want to be sure that they're okay. And we want to be careful to try to use open-ended questions rather than ones that typically might require a yes or a no answer, because that helps them to open up and engage more in conversation. And again, listen, listen, and listen. We want to open that door to keep them talking. So instead of things like you're doing this or you seem this way, we want to try to use I statements. So I notice that you're staying in your room a lot more and talking less. Can we talk about that? Think about how we use neutral and observable statements when we talk to kids. It helps to start conversations in a more non-confrontational way. And when we say things like, what I hear you saying is, am I correct? By using kind of reflection and checking for clarity, it helps the child to feel a little bit more understood. We also want to make sure that if we have concerns, we ask the question directly. A lot of people think that by asking a youth if they are thinking of killing themselves, it will actually put the thought of suicide in their head. The reality is, once you open that door and you ask the question, and once disclosed and the student is offered help, young people are usually relieved. But sometimes we need to remember we may have to ask more than once. And if your gut tells you that maybe they're not fully opening up or being 100% honest with you, ask again. Sometimes it can take asking a question several times before a child realizes you genuinely want to know the answer. And if your child says yes, reassure them that you will help them get through this and immediately seek professional help. So if we look at the next slide of how we might respond. So how do we respond if the answer is yes, or if we have some concerns? Know what your local mental health resources are. Know what your crisis hotlines are. In Collier County, we have local and national crisis hotlines on the back of all of our student ID badges, so that students have them readily available to them if they need them. Know what the local mental health crisis receiving facilities are in your county. And I think on the next slide, when we get to it, Sherry and I have put on there the Lee County and the Collier County receiving facilities. You also want to familiar yourself with the 24-hour mobile crisis unit that is new and now available in both Lee and Collier counties. Also, we have a lot of great new apps now for kids that talk about how to safety plan, how to calm, how to implement coping strategies. The iCalm app actually helps create a safety plan and coping strategies for when students are dealing with stressors or having negative feelings. We also have things like the I'm Not Okay app that alerts supportive family and friends when you're not okay in order to respond. All the student has to do is press the button and it goes directly to those individuals. So if we look at the next slides, you can see that we have the number for our mobile crisis unit, both in Collier and Lee County. That's the same number. We have, of course, our emergency 911 number, the two central receiving facilities, both in Collier, it's David Lawrence Center, and in Lee County, it's Salis Care. And on the last slide, we have our websites for both Lee County and Collier County, where you can find a wealth of resources, information, articles, videos that will help you find tips and resources for you and your student. And it also gives you access and information on how to get in touch with your school-based mental health professionals. So that concludes our presentation for today. Did we have any questions from anyone?
Oh gosh. What are some early signs of depression in grade school children, and how can parents help address them? That's a really good question. And I think that if you think back, some early signs of depression might be some of the same signs, that we have with some of our older students. It might be that they say they're sad. They may be crying more often. They may actually have a really hard time separating from a parent or a caregiver or a trusted adult. So, a lot of times with the elementary school kids, they will actually tell me, I am sad. That's one of the great things about our school systems is we have a lot of social emotional learning that goes on throughout the day, and creating those trust and relationships. And how can you address them as a parent? And I think it just goes back to what Caroline was saying, is just like listen to them, support them, and acknowledge their feelings, because it's very real to them. You certainly don't want to kind of brush it off and say, oh, you don't have any reason to be sad. I've heard parents say that. These are all the good things in your life. And it is good. It is important to point out all the good things, but also to acknowledge that your student right now is feeling sad, and really just sit down and listen to them, regardless of their age. Even if they want to draw a picture about what's making them sad, that's okay too, because a lot of times our kids, when they're little, they don't have the words. The only word they can say is sad, and sometimes they can't even share exactly what they're sad about. Caroline, do you have anything to
Well, and
add?
I'm thinking too, similarly to older students, we will see grade school children have a loss of interest in activities they previously enjoyed, not wanting to engage with peers, not wanting to participate in things both with family and friends that they previously had really enjoyed. So yeah, opening up that conversation and asking them what that's about for them. And sometimes, depending on how young the child is, it may be difficult for them to identify exactly what it is that they're struggling with. But just by you being there and letting them know that you care and you're there to talk to them, let them express themselves, whether that's through drawing, as Sherry talked about, or conversation or play. But we really want to try to get them to open up to see what that's about for them. But I typically see a real loss of activity in activities they previously enjoyed.
Go ahead, Caroline. You can.
So how can parents determine if their children's behavior is just a phase or if it's an actual sign of mental illness? So one of the things that we've talked about throughout this is looking for those extremes, that pervasive, perhaps taking that individual for a screening or assessment if you do have a concern, because a lot of times they can differentiate between whether or not this child is experiencing normal changes in behavior and development that typically occur with that stage of development, or whether or not they're actually experiencing a mental illness. So I think you want to look for those. I think Sherry used the word pervasive. We've talked about extreme, and get a screening for your child if you have concerns. Take them to a local mental health facility. Depending if you're in Collier or in Lee, we have some great resources for free screenings in Collier through HUGS and NAMI. I'm not sure, Sherry, what's available in Lee County, if there's anything for parents to go to for a free screening.
Yes, in Lee County, if you reach out to your school counselor, your school social worker, we will screen the student for you and let you know if it's something that we can help you with and support your student within the school system, or if it's something that needs to be referred out for a higher level of support. So in Lee County, if you reach out to your school, we'll be happy to complete that screening.
I'm not seeing any additional questions now, Sherry. So I think we want to make sure that if you're in Lee County, please make sure that you go to your Lee County Schools mental health webpage for any additional information or questions. You can always contact your school-based mental health professionals or myself or Sherry. In Collier County, go to the colliercountyschools.com /mental health for your resources as well. And you can always go to kidsmindsmatter.com too, where there is a wealth of information and resources available.
Thank you for joining us today.